Hi, I'm Stasha-Gae Roberts, nurse practitioner, and I am so glad you are here. I own Compassion Primary Care, an integrative practice that provides compassionate, personalized healthcare to residents of Brandon, Florida area and surrounding communities. Today, we will be talking about our thyroid, specifically hypothyroidism. First, let's just redo a refresher. The thyroid is a butterfly shaped gland at the base of the neck. It is a part of our endocrine system. It produces hormones which are essential for regulating our metabolism. The thyroid gland has many important functions, including regulating body temperature, energy, our menstrual cycle, our mood, heart rate, etc. According to the National Institute of Health, nearly 5 out of 100 Americans ages 12 and over suffer from hypothyroidism. Women are more likely to develop hypothyroidism than men, and the incidence does increase as we age. Essential vitamins and minerals required for proper thyroid function include iodine, selenium, copper, B vitamins, vitamins A, C, D, and E, zinc, iron, chromium, and magnesium. Deficiencies or excesses in these nutrients can negatively impact the thyroid. Medications that can affect thyroid and thyroid function include amiodarone, lithium, oral estrogen, birth control pills, and beta blockers. Hypothyroidism is a chronic disease associated with decreases in thyroid hormone. Thyroxine, or T4, is made in the thyroid gland, and triiodothyronine, T3, which works at the tissue level. Because thyroid receptors are located throughout our body, deficiencies in thyroid hormone will lead to a variety of symptoms. Untreated or undertreated hypothyroidism can lead to cardiovascular issues, which include elevated cholesterol or congestive heart failure, neurological problems, musculoskeletal issues, including fibromyalgia. Advanced disease can lead to myxedema coma, which can even result in death. Causes of hypothyroidism include the following: a malfunction in the pituitary gland. This gland secretes thyroid stimulating hormone, or TSH, which tells the thyroid gland to secrete T4. Thyroid stimulating hormone is normal, but there's not enough T4 or T3 being produced. The receptors on our cells are not responding properly to the thyroid hormone. The above causes of hypothyroidism can be related to autoimmune issues, iodine deficiency, environmental factors such as exposure to heavy metals, endocrine disruptors, chemicals, postpartum thyroiditis, hyperthyroidism treatment, radiation or thyroid surgeries, nutrient deficiencies, medications, excessive fasting or dieting, and pituitary disorders. Symptoms of hypothyroidism can include, but are not limited to, weight gain, constipation, puffy face, dry skin and hair loss or thinning, cold intolerance, chronic fatigue, joint muscle pain, depression, low body temperature, a slow heart rate, loss or thinning of the eyebrows, irregular or a heavy menses, brain fog. Now, when evaluating the thyroid, a proper assessment is needed. Thyroid function testing and other labs as deemed necessary based on the patient's presentation and their symptoms. Thyroid function evaluation should include thyroid stimulating hormone, or TSH, free triiodothyronine, or free T3, free thyroxine, or free T4, TPO, and thyroglobulin antibodies, and reverse T3, which is an inactive form of T3. In addition, nutrient deficiencies like the ones I've talked about previously and evaluation of cortisol with a 4-point cortisol test should be a part of the thyroid evaluation. Now, in conventional medicine, typical treatment for hypothyroidism involves starting someone on a T4 replacement only, which could be either levothyroxine or Synthroid. However, the integrative or functional medicine approach usually includes both T4 and T3 replacement with medications such as Armour or NP thyroid. In addition, dietary modifications, stress management, adequate sleep, and replacement of nutrient deficiencies are also incorporated into the treatment plan for a more well rounded, holistic plan. Now, let's talk Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune disease affecting the thyroid. Autoimmune disease occurs when our body mounts an immune attack against itself. So, this is more of an inflammatory issue. Hashimoto's is the most common form of hypothyroidism, and again, women, we check the box, so we are more likely to be affected than men. Hashimoto's can also be referred to as chronic lymphocytic thyroiditis and autoimmune thyroiditis. There are many causes that contribute to this type of autoimmune disease, and they include environmental factors, genetics, again, nutrient deficiencies, gut dysbiosis, acute or chronic infections, food allergies or sensitivities, etc. Autoimmune disease tends to beget autoimmune disease. This means that if you are an individual with another type of autoimmune illness, such as type 1 diabetes, Sjogren's disease, celiac disease, etc., the risk of developing another autoimmune condition, such as Hashimoto's thyroiditis, increases. It is possible during the initial stages of thyroid destruction for one to present with symptoms similar to hyperthyroidism. Those symptoms include anxiety, palpitations, sweating, increased appetite, etc. But once the thyroid is totally destroyed, the symptoms will look more like hypothyroidism, which were discussed earlier. Again, with evaluation of a person for Hashimoto's thyroiditis, we need a proper assessment, evaluation of thyroid function, and other labs deemed necessary based again on the assessment of the patient and their symptoms. Testing includes TSH, free T3, free T4, the thyroid antibodies, TPO, and thyroglobulin, and reverse T3. Nutrient deficiencies, evaluation of cortisol hormone with a 4-point saliva test, stool analysis, and evaluation for chronic infections are all part of the treatment plan. In integrative or functional medicine, proper treatment includes, again, identifying and treating the underlying cause. Is it an infection? Food sensitivities? Is it gut dysbiosis? That is key. Detoxification. We need to be sweating. We need to be having proper bowel movements. We need to be urinating daily, and most of us don't do those things well. Dietary changes. With Hashimoto's, usually one of the main culprits is gluten, so this means a gluten-free diet. Stress management, proper sleep, thyroid replacement if needed. Low-dose naltrexone is great for reducing the inflammation and decreasing those thyroid antibodies. And then replacement of nutrients when needed. This was a broad overview of hypothyroidism. If you have concerns about your thyroid, please contact us for additional information. Now, are you tired of short impersonal visits or feeling unheard during your healthcare consultations? If you want a more personalized, compassionate approach to healthcare, I invite you to contact Compassion Primary Care. I am committed to assisting my patients in nursing their journey to lasting wellness. Please like, share, and subscribe to this channel. Thank you for watching. I am Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Bye-bye.